Hi everybody, Dr. Isiorho, Dr. I here. We have a patient unfortunately who has an ingrown, so we're going to be taking care of this. This is the patient's first time that they've had it. They had some oral antibiotics and we have some betadine on here, so you may not be able to see all the redness and erythema, but basically right here. We're going to do an avulsion, a partial nail avulsion, where we take a third of it. Now, some people ask, well, why aren't you just taking that little sliver of nail out? Well, the reason why we're taking only that little, we're taking a little more than that sliver is because this patient's nail curves down so much that if we took just that little sliver out, you see how this flesh is nice and proud and swollen or edematous? It will actually invade that space where the nail has. And so instead of having an ingrown here, you'd have an ingrown right there. And I don't think the patient or the mother want that. So we're going to do one and get done with it, and then when it starts to grow back, we'll teach the patient and mother how to take care of it, and hopefully this will not be recurring problem. So the patient is numb. We have our little gauze that's going to collect any fluid that comes. We're using our Band-Aid for a tourniquet. I'm using my hemostat so I don't forget the tourniquet. And I'll ask again, my patient, are you feeling any pressure or sharpness at all?
On the tip of the toe?
Yes. Are you feeling sharpness like this?
No.
Okay, good. That means our patient's good enough. So I start with my stat, and I basically start to lift up the nail fold. And then I go under and lift up the nail fold again. And our patient, like I said, is good and numb, so this is going to be really simple for him. So now that everything is lifted up, this is my favorite part. Take about the portion I'm going to remove and flip it up. And that just is a proof in the pudding, and you see how much of that nail is actually going into his toe. And so that's part of the nail that we're actually going to remove. So now that it's out, I'm literally just going to remove it. And this is why I like the way I do this procedure, because it's just so simple. Now I see if there's any residual nail spicule in there. There might be a little bit I'll clean up, but this is basically what the patient's going to be left with. And this is why we don't usually recommend antibiotics after nails removed, because after nails removed, basically the offending portion is gone. So this is what we removed out of his toe. And again, you can see what was painted in betadine and what is not painted was a portion that's actually out of his toe. So now that that's gone, this is what I say, we church it up, make it look pretty. And again, Mom, you can see where I was actually digging in there as well, too.
You're pretty much done, dude.
So now we're dressing it up.
That was fast, huh?
So I have Vaseline impregnated gauze and antibiotic ointments right here. Generous, generous, generous. More is more in this case. Our 2x2 gauze. So patient, you're going to keep this dressing on for 24 hours. After 24 hours, you're going to soak this dressing off. It's important to soak it off in water and not just remove it dryly, because it's going to hurt. So when you soak it off, you want to clean it with antibacterial soap and water, and you want to pat dry it. You don't want to rub it, just pat dry it. After you pat dry it, you keep it on for another 12 hours, and then you do a foot soak. Again, we'll have some instructions that explain this. You're going to soak it twice a day for 5 days. A shower is a soaking. So if you shower daily, then that counts as one of your soakings. On day 5, you will not use any more antibiotic ointments. You'll just put on a Band-Aid. On day 5, you will not soak it twice a day. You'll just soak it once a day. And on day 5, you will not wear a Band-Aid at nighttime. You'll just let it air dry. And in terms of pain, you'll be able to take some Tylenol or ibuprofen, your pain reliever of choice. The medication went into your toe a little bit before noon, so I'd say around dinner time is a good time to take an ibuprofen or relieve with that. Otherwise, you're all said and done. We'll see you back in 2 weeks. Do you have any questions at all?
I don't.
All right. Take care.